Good morning, all of you. So, today we will be dealing with common health problems which we can see in old age. So, we have already seen the system wise changes, age related changes in old age. So, here similarly, but little more uh, important one, the health issues, main health issues or the diseases, common health problems and their nursing management. These all things we know. It will be just like a revision. So first one, cardiovascular diseases. So cardiovascular diseases is common in 50% of the population over the age group 65, and it accounts for 40% of death in this age group. So there are different kinds of heart disease: atherosclerosis, arteriosclerosis, myocardial infarction, heart failure, hypertension. Whatever heart diseases are there, all these things you can write, except congenital heart disease. Congenital heart disease mainly affecting the children's. Okay. So due to advance in age, the disease easily find its way to the old people, and so it should be carefully diagnosed and properly treated. So similarly, we will be studying about the cardiovascular, some of the cardiovascular diseases name and some of the nursing diagnosis. So likewise, we will be continuing with all system. So all these things you know. So it will be like a known thing which is again uh, lecturing. One thing is it is very easy for you. Second thing, if it is coming for exam, that also will become easy for you. So okay, when diagnosing, look out for cases of fainting. Ask the patient, the person for any continuous chest pain, nausea, shortness of breath, rapid heart rate, rapid weight gain, pain in the abdomen, swelling of legs. All these things should be asked with the person when he is arriving for care. So then find the risk factors, like whether the person is having hypertension, high blood cholesterol, diabetes, obesity, overweight, smoking, hereditary, or if any treatment is taking or any surgery is being completed. So all these things should be assessed. So treatment, what treatment we can give? We can provide medication as well as physical exercises. So we'll be seeing some of the nursing diagnosis. So here I have already mentioned in two part, mentioned as two part. So you have to write it as three part. So alteration in tissue perfusion related to decreased cardiac output. So intervention, all these things are easy. So at least every 1 to 2 hours, assess the vitals. Rationally you can write by yourself. So BP less than 80 means it can indicate shock or maybe decreased amount of fluid. So decreased amount of fluid or fluid deficit can be find it out by decreased pulse. So if the capillary refill is less than 3 seconds, again decreased amount of fluid in the body, or hypovolemia, or decreased peripheral perfusion. So if there is any temperature variation as well as peripheral pulse variation, that also indicate tissue perfusion. So we can administer supplemental oxygen according to the need of the person, so that we can increase the myocardial blood supply, oxygenated blood supply, so we can prevent the ischemia. So we can also check the urine output hourly. So if the urine output is less than 30 ml per hour, we can suggest decreased renal perfusion due to decreased cardiac output. So that is the first one. Moving to the second, acute chest pain related to coronary ischemia. So here you can remember these nursing diagnosis and intervention you can write by yourself. I'm not telling that you have to stick to this point itself. You can write your own points. So in chest pain, we have to assess the signs and symptoms of the actual pain, where the pain, the location, the intensity, the duration, onset. PQRST we can assess. So use a pain scale to assess the severity. If by assessing the pain, we can also find out the effectiveness of medications if we have given any medication. So we can obtain an ECG to find out any arrhythmias. So we can provide a wide variety of medication, nitroglycerin, morphine, analgesics to control pain. We can provide beta adrenergic blockers, calcium channel blockers, all kind of antihypertensives to control the coronary blood supply as well as demand. So we can provide anticoagulants as well as thrombolytics to avoid the thrombosis. So all these drugs should be given based on the prescription. And the final one is deficient knowledge related to CAD. So its management as well as the prevention and potential risk factors. So interventions as well as rationale: assess the patient's knowledge and understanding of CAD, instruct the patient as well as a family about the difference between angina and MI, so that they can immediately act when the need arises. So we can save the person's life. So review the risk factors and help the patient to identify the modifiable risk factors, so we can control further progression of the disease. So that is all about cardiovascular diseases. See, if a question is coming, common health problems in old age, you can write by yourself. See, you know what are the major common diseases in old age. So you can list down all the cardiac diseases which we can see in the old age, and you can write your own plan. See, clear? Is it clear? Okay.